I'm taking a deep breath here because I can't believe we're already mid-August. The state fair has begun, and where has the summer gone? Well, thanks for joining me this morning. Today's agenda is going to look something like this. I'm going to cover announcements first. A lot of times I hold those to the end, but I think I'll go ahead and hit the announcements first. And then I'm going to give you a recap of the Wellmark Producer Forum. Now, several of you were there. They had them last week in Cedar Rapids, there was one, and this week in Des Moines there was one. And this is Wellmark's way to communicate directly with agents and get their messaging out. And so I'll give you a brief synopsis, not to bore those that were there that are on the call this morning, but I think it's good to review and also maybe generate some comments or questions about the direction and where Wellmark's going, and not only with product, but also with us, their distribution channel. And then we just completed the last 2 days of the Iowa Association Healthcare Symposium, and it was a jam-packed couple days. Lots of great vendors were there to support us and give us new ideas, and some really great speakers. So we'll touch on that, a couple of key takeaways from there. I want to mention and make sure you guys are aware of the Medicare Access and Chip Reauthorization Act of 2015, a piece of legislation that got passed that is going to impact us, those that sell in the Medicare space. And hang on, because my screen just went blank. Yep, so if you're seeing a black screen, so am I. One moment. I'm thinking it might be a GoToWebinar issue. Okay, let's try this again. Okay, now I've got a screen back, and I'm trusting you've got it back as well. And go ahead and use your chat board if you want to shoot me a note. Make sure you can that you can still see my screen. Sorry about that. And then any other updates or questions, of course, we'll cover it from there. So let's dive in. Here's on the announcement portion. I want to thank you for completing the survey that you would have gotten from Wellmark. It would have gone to the person that is the head of your SRA. If you recall, they call them SRAs, sub-retail agency. And what they did this year, instead of going to the head of the SRA, because sometimes that's somebody that has nothing to do with health insurance, they sent it to the person inside of the SRA with the largest block of business. We have been making some outbound calls and or sending emails from our office. We do not know if you've completed it or not. They don't give us that information. They just let us know who they sent it to. So anyway, if you've done it, thank you again so much. And if you haven't, please do it today. I think the deadline is coming up here quickly, and it might be today. So I appreciate that. We've been, I think I announced these training dates last month, but I want to announce them again for fall training. As you know, we always have fall training, Wellmark, and we offer continuing ed credit. Probably the reason why we've hesitated sending out anything yet is we were trying to figure out how long Wellmark's training would be, and is there additional carriers that we can bring in and offer some additional information as well as continuing ed. So we did find out from Wellmark these dates: September 15th in Storm Lake, the 16th in Des Moines, the 18th in Cedar Rapids, and the 24th and 25th. We'll do 2 sessions on those back-to-back days in Fort Dodge at the Starlight. We did find out that Wellmark will go from 9 to noon. And then what we're looking to do is offer lunch and then some additional continuing ed credits in the afternoon for those that need it. So we don't have that finalized quite yet. I've been in touch with a couple other folks. So anyway, kind of stay tuned, but if you wouldn't mind, block that on your day in terms of which location you'd like to go to, and then we'll firm up the times. But I guess at this point, I'd block the day. And if you only need the morning, then you need the morning. So, but we will have some additional credits. We just don't have that locked up yet. We tried to get, speaking of additional training, we tried to get the Medica folks to jump on to the afternoon sessions here. And they are going to do, they're kind of following in the footsteps, well, only for training, from what Co-Opportunity did. And what they did was they just said, nope, we're just going to go out and we're going to do some general sessions for any agent that's being contracted with us. So September 30th, they've already scheduled that date for Des Moines session and October 1st in Davenport. And like those are going to be their only 2 sessions. I talked to them yesterday. They were at the symposium and as one of the exhibitors there, and they were also representative on the carrier panel. But they were mentioning that they don't have their times determined yet. Are they going to do a morning session and an afternoon session? Is it just an hour? Is it 2 hours? We do know that there's no continuing ed credit for the Medica training. So, but stay tuned on that one. If you want to make a note on your calendar, if you plan on offering that as one of your products in your portfolio, that's Medica. They are, in 2016, they'll be in the individual under 65 space only. In talking to them yesterday, they did indicate that they have Medicare products as well as small group products, and they'd be looking at bringing those into our marketplace possibly in 2017. So nothing for sure yet, but know that this Medica as a carrier, they've been in the business over 40 years. They're a nonprofit. They've been primarily in Wisconsin, Minnesota, and North Dakota. So yeah, it'll be interesting to see how this one develops, but I just wanted to give you that heads up on that upcoming training as well. Also talking to United Health One and trying to figure out with training, and could I tack them onto the end of the Wellmark training sessions, as strange as that might sound. And so again, we're still trying to line up that afternoon, but it's coming, and as you know, they are back with individual products in the under 65 space. Otherwise, you know, they touch all the markets that we cover, and now they're back with individual products. They had just been here with short-term products for the last couple years. So they're back with some, they'll be back with some new products come 2016. Remember, on any of the carriers that we talk about, if you have any questions on any of the markets that you serve, contracting for all of our carriers is handled through Nicole. I think she does a great job with you guys. I think she does. Let me know otherwise. But you can get a hold of Nicole for any contracting. And you know, another carrier was there yesterday that I visited at the healthcare symposium, and that's Health Alliance. And Health Alliance is an Illinois, like a Southern Illinois-based company, and they were also on the carrier panel, which was a little surprising to me. They don't have a lot of presence in Iowa. They had closed their Ames office, and so I talked to the gentleman and said, we just don't hear a lot from you. We're hesitant to bring you up and recommend you and quote you because we just don't know about the service and support, and then let's talk about the network. And so I think Health Alliance is looking at trying to make a comeback, and so stay tuned on that. We have a general agency contract still in force with Health Alliance as well. So again, if you have any questions on contracting carriers that you've heard about, wondered, if you want to get contracted, please give us a call so we can let you know if we've got a contract, or sometimes we've had agents that have encouraged us and then we've gone and gotten a contract. I'd like to think we have all we need right now, but you never know. So another announcement on AHIP, it is available now. More direction will come soon from us. We last year put out, and I thought it was a terrific document to help you guys, because it said, here is how you get, you know, set up for the, I'm talking now Medicare, the Medicare market for Med Advantage and Part D. So you get your recertification done, et cetera. So we'll put that document together and get that out to you. What we've heard so far is Humana seems to be offering the best deal. So if you are interested in getting contracted with Humana, if you do your AHIP through Humana and sell so many policies, you get, you know, this rebate back, or, you know, I shouldn't say rebate, but you'll get money back for your covering your AHIP training, because as we know, it's like $100 or $200. I mean, it's not cheap to do the training, but many carriers will offer some kind of help with that or assistance if you write so many policies, and it seems that Humana might be the one there. And say, I'm going to make a comment, and it's so funny. I'm like, let's just keep it between us on the call, okay? But rumor has it, and I guess if you repeat this, then you didn't hear it from me, but rumor has it that Wellmark's value plan is going away this year for 2016. And so now, before we all panic, the thing I think of is, holy cow, how many clients did everybody move to the value plan, right? Like, a lot of people move to the value plan. If they do away with that, obviously they will track that to another plan. So they would say, hey, we're doing away with this plan, but here we're going to put you into our standard plan. We don't know what the standard plan is going to look like yet. My hope is, right, that if they're going to do away with the value plan, maybe their standard plan has come through and is going to look better, right, than the standard plan did this current year. So anyway, more to come on that. And it is concerning because, as you guys know, the more volatility there is in this market in terms of carriers changing their plans, changing their rates dramatically, causes more work for us because we end up, having to move those clients instead of leaving them where they're at. I haven't heard yet anything about Humana's rates or products. As many of you have moved a lot of folks to that $15.70 Humana plan, and we haven't heard, but of course if that stays similar, then that's helpful, that a lot of people will just sit tight with that cheapest plan in our market. So, okay, so that was a little on the down low and just a little heads up. So more to come on that. I'm going to jump down to the PDP letter getting updated because we're on the Medicare market right now. And I want to make sure that you guys know that we've got a template for you to use if you have enough PDP clients that you want to send a letter versus make phone calls. And maybe you want to do both, but I'll tell you, we've set up a process and really wanted to duplicate that for you if you're interested with, and I've shared this with many of you on my agent visits, but it's a letter along with just kind of a template letter, so you insert your stuff in there, and then a copy of like a formulary sheet, like what are you taking, and then have it, update that, right? And then you put in both copies of a scope of appointment, a generic one. I call it generic. It's a UHC one actually, but UHCs, Humanas, Aetnas, Coventry's, those will all be accepted by all of those carriers. Wellmark's will not, their scope will not be accepted by anybody else, and Wellmark will not accept anyone else's. So that whole packet of what you might want to send out to your PDP folks, we're getting the letter updated for this year, and we'll get that out on our website. We've got the current one from last year that's out there now. When you look at, when we say it's out on our website, typically if it's kind of a marketing campaign or something you're going to communicate to your client, it'll be under marketing and campaigns. So when you go out on the KHI site, if you have any trouble, just holler at one of our staff and we'll walk you through it. So I wanted to mention that to you. If you want to use something like that, just holler. Lindsay and Julie are our experts in the individual market, and then we've got Katie and Jenny with backup, and Doreen that help back us up. But those are really your 2 points of contact in the individual market and specifically around the Medicare and certification. So as I said, we'll be sending you out a letter to go, here's how you get set up with all the carriers. Here's how you get access to them. Here's how you do your AHIP, and all that stuff is coming as well, the updated packet of information for your Medicare clients if you want to reach out to them and get their updated formulary and kind of request from them, sign the SOA now. And then once they send that back in, you can reach out to them or have maybe an assistant reach out to them, or an intern or somebody you might be having help reach out to them to set up an appointment with you. And I'll just comment one other thing. Since Medicare.gov allows you to, save the formulary that you've inputted for that client, and you've probably figured this out, right? But if you have that information, then going in and updating their formulary with any changes, and then running that against the 2016 plans to see very quickly if you even need to meet with them at all. And of course, we'll know more once we know what the plans look like. But anyway, that whole process, hopefully, if you haven't had help getting that a little more automated and maybe just a little more structured to make better use of your time, so you're not meeting with those that don't need to meet, and you're putting the onus on them to reach back out to you to schedule an appointment once they've signed their scope of appointment and giving you their formulary updates. Okay. Back up to another announcement here that Wellmark group renewals for 12/1. We were at the producer forum with Wellmark talking to the folks there. They've got about 5,000 renewals, he said, that are ready to be released in about, they said, 15 to 20 days. So it's really coming up here in the next, I said few weeks, but it could be less than that. Of course, we expect them by September 1st. So just know that's coming. And I do want to mention something else to you, and I'm hesitant. I want you to know, again, we're going to keep this among us today. because we'll know very, very soon what Wellmark's move is going to be on this. But they think that there might be some wiggle room for grandmothered plans. So stay with me here. In the grandmothered space, as you guys know, they're going to stay grandmothered for at least another year plus, right? It'll actually be into 2017. And we thought, of course, it was 2016, but if they renew by October 1st of 2016, they'll go into 2017 with their current grandmothered plan. And in particular, they've been restricted to only being able to renew with their current grandmothered plan. And what is being considered is the ability to maybe allow them to pick another underwritten plan within I don't know, Wellmark will have to define it, but give them some additional choices within the grandmothered space and still remain grandmothered. And this, as you guys know, this is not what's been happening in the past. It's like you keep what you have. If you make a move to another plan or you move to another carrier, you instantly lose your grandmothered status and you become ACA. You have to then purchase an ACA plan or ACA compliant plan. And then you also, that can make changes to how your plan is rated. So just know that we are in touch very closely with Wellmark on what's going to be happening here. The renewals that will be released, whether they're grandfathered, grandmothered, or ACA, the 12 ones, and then of course 1 ones will follow right after that. But just know that we'll work very closely with you on the latest information that we have. So what could happen is these renewals get released in the next couple weeks, and then we find out in another couple weeks if that group will have some additional choices within their grandmothered plans. So I hope I'm not muddying the waters, but for those of you that play in that group space, it's an important piece. And again, we'll find out what Wellmark's decision will be. Okay, and I maybe just generated a whole lot of questions, but let me just tell you on that one, sit tight, because we don't know any more than that right now. And as soon as we know more, we'll let you know. And of course, Nakia and Tricia in our group department and Sarah as well are really the ones that are point on that. So call any one of the 3 of those folks for updates on any like where's my renewal at. But sit tight yet. The renewals are scheduled to be out September 1st. So in addition, this is kind of also a follow-up in the group market. These next 2 items on the compliance checklist. We've been working on this thanks to another agent, Todd, who had said, Lynn, we need help with compliance, and can you help us with some kind of a checklist? And also knowing on this checklist, where do we go to get that item? So if we're sitting through this checklist and it says you need this item or this document, we want to try to help provide. That comes from the carrier, so we don't have to worry about that. That is provided by the carrier. Or this one is, for example, the ERISA wrap document, the next item here on our announcement page. If they do not have an ERISA wrap document and they offer employee benefits, they must have this regardless of their size unless they're a church or a governmental agency. So if they're a religious organization, i.e. a church, and I'm sure it has to do with their filing status for taxes, or if they're a government entity, they do not have to have an ERISA wrap. Otherwise, every other group has to. That will also be on our compliance checklist. We do have the document that you can use to send out to your clients. It's on, again, since it's a campaign that you would send out to a client, you'll see marketing under resources, you'll see marketing solutions, and then you'll see campaigns. And then you'll find the documents there. And we have it separated out, individual and group. And there might be something else. So anyway, but it's separated. You'll be able to see it. If not, just again, holler at one of our staff. So lots of good stuff. I'll tell you, we've just spent a lot of time this summer hopefully getting everything ready and streamlined and online and process-driven so that we make it real simple for you as we all struggle through this upcoming period from really it's going to start September 1, right? But it really starts to heat up, of course, in October with the Medicare, then November with the Obamacare stuff. So hopefully we can all take a deep breath, start getting our training in, and then get through this period of time. Okay, last but not least on the announcements is pet insurance. And I want to make sure you guys know, and you guys have other alternatives maybe to get access to it, but we just thought, you know what, we're going to go ahead and offer it. We're going to learn about it, and we're going to become the experts, if you will, on helping you offer this to your clients if you see that as something. Now, this was probably really a great idea in maybe May or June, right, when we were just coming off of our busy time, maybe March, April, May. I know we're starting to heat up again, and so pet insurance might, for you, get put on the back burner. But if you want some little brochures on it, or you want to know more about it, do you think that would be something you'd like to maybe put on one of those little stands in your office so that when people come into your office, they can see and ask about it? Just give Lindsay or Julie a holler in our individual. There are individual experts, and this is, by the way, an individual and a group product. So you want to make yourself unique. Or I know I talked to an agent the other day that has a client of theirs has dogs running through the office, right? If you go see a client and they have animals in the office, this might be really cool and something that will continue to set you apart from your competition. So just know that it's available on an individual and a group basis, and just give our office a holler if you have any other questions on it. But we're pretty excited about offering that. Okay, so what I want to do now, and I'm just going to take a time check here to make sure I leave time for questions, but I want to just review with you the Wellmark Producer Forum, which I really thought was an excellent meeting. And this is open to agents. But my commitment and Brenda's commitment and Andy's commitment to our agents is to, if you can't be there, I'm going to give this to you. If you want more information and this triggers some conversation that you'd like to have with me, please shoot me an email and let me get out to you, because it is my job to come out and see you. I'm doing my best to get you on my calendars and see you as when I can, or if it's maybe before or after a meeting that we've already got scheduled, maybe training, and we grab a cup of coffee or meet after a meeting that we're already at together. I'm happy to do that as well. So so the first speaker was fantastic, and in fact I'd like to have him come back next year and give us an update through Health Underwriters. I'll be responsible for the symposium for Health Underwriters next year, and I looked at him. His name is Patrick Barlow, and he was really good. He's from a consulting group, of course, and he really talked about what's driving and shaping healthcare. And so this is the stuff that if somebody, your clients ask you, you're at a cocktail party or at a networking event, wherever you are, as an agent and as a professional in this industry, this has to roll off your tongue. When somebody asks you something like this, of course it's the cost of care. It's how much it costs to get that MRI, to get that knee replaced, the hip replaced, to even be admitted into the hospital. It's the cost of care. It's regulatory changes. It's how are we as employers, employees, consumers, et cetera, aware and engaged. And you have to admit that the ACA has caused consumer engagement and awareness, right? This gets into driving people to take those qualified high-deductible health plans, or they call them consumer-driven health plans, where they're paying first dollar, right? They tend to be more engaged. They'll shop more. And then who can neglect the technology? He said, one of them, how many people have Fitbits? I mean, how many people raise their hands? We are using technology to track and become more aware of how we are using healthcare and how healthy we are as consumers. And as agents, we need to not only, I think, be on the cutting edge of this, we need to lead by example. So if you don't have a Fitbit, get a Fitbit or a Jawbone or whatever device you want to get. And so these are really the areas that we're seeing is shaping / driving all the changes that are happening in this marketplace. And then he kind of talked too about being patient-centered and consumer-powered, and I really liked these two components are also obviously contributing to shaping where we're at today with healthcare, but it's really around patient-centered. This is where hospitals and doctors are really focused, is on how care is delivered, how they're reimbursed. You know what's interesting is, you guys remember we did a conference call, a webinar a couple weeks ago on telemedicine. If you missed it, it's out on our website, and we believe this is a perfect example about how using technology and changing how care is delivered is changing the face of healthcare. And so make sure you know about that and can begin to talk to your groups about that. Bring that up, talk to them. We've got a great presentation out there that Pete Cohen did for us from Healthiest You. So, but that's a good example besides the Fitbits. It's now talking about how care is delivered. And I will get into the symposium a little bit in terms of what they talked about, because there was a little bit of crossover. But I'll tell you, the whole reimbursement for physicians, it really is going to be a less volume-based and, of course, quality-based and keeping people healthy. So that's a whole interesting piece there. And then the consumer-powered piece is really around how we shop. Are we getting the quality outcomes from these doctors? And why would I shy away if I'm going to have elective knee surgery, let's say. I tore my meniscus, and many of you know this did happen to me a few years ago. I just went to whoever my doctor told me to go to. What is that, right? And that's just how we've done it all these years, but why wouldn't I shop for best quality outcomes? Oh, and by the way, I have a qualified high deductible health plan. That first dollar coverage is mine. So I do want to know, how much is this going to cost me? What does it cost to actually have the surgery and the anesthesia and the surgical center doing it outpatient, et cetera? So I think the app that I've downloaded on my smartphone from Wellmark, telemedicine, the Healthiest You folks on telemedicine had a phenomenal mobile app tool to shop for the closest doctor in my network. If I connect to my carrier, it would do that. So I'll tell you, if you're not getting plugged into this, get your smartphone, download these apps. Wherever you have your health insurance, get on their site, get their app, get plugged in, because this is what our clients are expecting of us, for us to be able to deliver the news. Wellmark, and I'm sure many of the others will have it, but I know Wellmark's got a great one-page piece on the Get Mobile and Get the app. That's another great piece. Stop by your employer groups with that, or bring it when you talk to them for their renewal. But say, hey, let's make sure everybody's got this. And again, it's one more way that you're getting them connected. You're staying in front of your employer groups. And if you need to know what that item is and get that order, just call our office. We'll help you get that ordered, and we'll ship those out to you so you can get those to your clients. That's just one example. But here's the bottom line, and you guys, I have to tell you, in the last, I'd say, I know we've been doing these monthly webinars for at least, I think we're coming up probably on 3 years that we've been doing these conference calls every single month. And I started out saying this over 3 years ago, that you will either get in or get out of this marketplace. And if you are in an organization or in an agency where you are trying to do it all, you're doing the investments, you're doing the property and casualty, you're doing health care, whatever you're doing, either you need to specialize within your agency, and I've talked to many of you about this, and you're doing this, find other partners to step in and help, right? But if health insurance is a main source of revenue, or you want it to be a main source of revenue in your agency and with your clients, then you've got to commit to this. And so they're talking about embracing ACA. We can't poo-poo it anymore. We can't say it's going away anymore. And you and I both know there are agents out there that are still telling their customers, don't worry about it, it'll probably go away. There are opportunities out there for agent of record changes for those clients who still have their heads in the sand because their agents have told them not to worry about it. So just know that this is not going away. This is what we're hearing all over the place. In the 3 days Brenda and I were at all of these meetings, we're hearing the same message. So you have to become that expert in your marketplace to your clients. It's going to embrace products. It's going to embrace who are the new players. You've got to know who the competitors are that are in our marketplace, what technology is being engaged, so that you can be of most assistance to your customer. Because if they're not getting it from you, and if you're thinking about retiring, then we've got to have that conversation about your succession plan. We started talking about that also a couple years ago. So, okay, see, I get on my little bandwagon here, but let me go to the next slide. Then they started talking about rates and why are they increasing, and you're going to get hit by your clients. Why are the rates going up so bad? And so, you know what? We're not going to have the answer necessarily that a carrier has, but we can talk about the spend. We might be able to talk about, and maybe one of these numbers will speak out, and jump out to you. And again, this will be on our website after today. We'll have this presentation out there so you can pull these slides up and print it out if you want and carry it with you. But look at this. Where do we spend the medical dollars? 36% with the physicians, 20% with pharmacy. By the way, that's up from like 14% just a matter of a few years ago. That's up to 20% of our total medical spend is in pharmacy. 19% inpatient. That's going down. Look at outpatient, 25%. They said those two numbers were flipped just a matter of a few years ago. As you can tell, they're driving more outpatient procedures, trying to streamline, lower costs. We know it's more costly to go inpatient than out. But when you look at these numbers and then say to a client, it still is driven by the amount of usage. We are using our healthcare system like never before. And then on the individual market, a big difference has been the guaranteed issue. There have been people that just went without, and all of a sudden when it's guaranteed issue, you might find people then buying insurance that never had it before so they could get a certain procedure done. That Wellmark definitely saw that happening. And then, of course, the mandates for the ACA benefits, driving costs up, especially in the individual market where they really had to provide coverage like mental health benefits, maternity benefits, right? Because those were riders prior. So that's what they talked a lot about that. But again, at a high level, just get comfortable with that. The pharmacy trends, wow, we know that more and more drugs, and this guy was hilarious. He really did a great job, as dry as pharmacy can be. But it was funny because he was like, well, the actuary, the rates went right before, and he goes, all right, well, now that you're thoroughly depressed, he goes, can I get you a medication? You know, and truly, you know, that's what we're doing in our market. We've got to maybe turn that tide. And Wellmark's big push over the last really probably 10 years has been the move to generics, and they've made great success and great strides in moving folks to generic. But the part they're focusing on now are the specialty drugs because they're so expensive. And there's more on that, and if you have questions, just give a holler. I won't go into that whole thing. But they will, by the way, here's another announcement. They will have a new pharmacy benefits manager effective 1/1 of this year. It will be CVS Caremark. And they went away from Catamaran, if I remember correctly, and I believe Catamaran was purchased by United Healthcare, so it makes sense that they'd move away from them. But I will tell you this, their plan is that this should be seamless. This should be have no issue. In other words, they will get a new ID card, but that's it. So anyway, more to come on that, I'm sure, so stay tuned. And then on retention, on individual and small group, Sean McTaggart did a great piece here. Now, look at some of these rate increases. And the letters, of course, will be going out to your clients. So this is where, if you play in the individual space, you've got to buckle in. You've got to buckle in because I'm telling you, when your customers come back to you, my guess is, what are they going to say? What else can I do? What other options do I have? And so that's why I told many of you about this, and I want to remind you that we have looked at a tool that would be a quoting tool that would encompass Medica, Coventry, United Health One, and we're asking Wellmark to be part of that. We have a meeting with Wellmark leadership next week. I'm going to be asking them to allow us to utilize this tool for our agents to be able to lay Wellmark alongside the other carriers. And I'm going to try to convince them that this is a defensive measure, Blue Cross. It's not that, see, that in their comment, we don't want to make it easier for you guys to shop them. And I want to say to them, you need to help our agents defend you, right? Now, at the same time, let's consider the other players in the marketplace. See, as you guys know, and I think many of you are aligned with me, we are not loyal to any carrier. As independent agents, our loyalty is with the client. My job as your GA is to give you all the options that you can lay in front of your clients to help them find the right solution. So all I want to say is we are working diligently to try to help make sure that you've got the tools and the products to be able to help your clients go from freaking out, right, with having, I was paying $100 a month, and now I'm going to be paying $600 a month, or whatever the case is. So, and maybe they're not subsidy eligible, right? So that whole thing. But look at some of these. Maybe we think small group is going to be okay. Hopefully, many of these groups will just renew as is, and let's not deal with it until next year, right? and they'll stay grandfathered or grandmothered. If they're ACA, they'll look at their choices and they're good to go. And we do believe rates are going to level out in the next probably 2 to 3 years once everybody gets moved to the ACA platform, assuming that it goes that direction, and it looks like it will. Anyway, it's so these rates are just know that we're working for you. We'll let you know more as soon as we know more as we enter into this really crazy time of renewals for both individual and small group. I do want to comment, and thanks to Lloyd for bringing it up to me. As many of you know, I was on vacation last week, and the Blue Briefing came out while I was on vacation, as well as some notes to all the GAs about the commission level. The small group 1 to 100, remember we talked about this last month, we've talked about it months past, that the definition of small group is going from 1 to 50 to 1 to 100, effective 1/1 of 16. Wellmark looks at it and says, okay, well, if this moves forward, that 51 to 100, that group of small groups, that cluster of small groups, if you will, in the past, they have had commissions built in by you and us, right? That was remember that whole transparency thing that happened a couple years ago, and we had to disclose, and we had to have the customer sign off, and we could build in whatever we wanted to build in the 51 to 100 space. It's actually 51 plus. We could build in whatever. Because of the small group definition change, the carriers are required to have the commissions built into the premium, and Wellmark has come down on at the place of $24 PMPM to the agent. So we'll get an override on top of that. That'll be built in, and that's separate. I don't know what that is right off the top of my head. I haven't seen that. I was talking to Kim Abram from Wellmark yesterday, and she said, yes, the $24 PMPM, we looked at it. We looked, some agents are going to win and some agents are going to lose. If you were getting paid, now not your total commission, because remember KHI took a piece of that. We did the 80-20 split, remember? But if your commission netted less than $24, you're going to be making more money. If it was more than $24, you're going to be making less money. Now remember, this only kicks in if they go from their grandmothered status to ACA. In other words, if they're 55 lives today, let's just say they're in that 51 to 100 space, and they're 55 today, and you renew as is, they maintain their grandfathered or grandmothered status, that commission won't change. It's only going to change once they become part of the new rating methodology in that small group of 1 to 100. So if you put it off another year and they stay grandmothered, that commission stays the same as well. So this will not impact you until they move to that newly rated 51 to 100 now being rated small group with member level rating and lose their grandmothered status or grandfathered and go into an ACA plan. Okay? So we were kind of panicking a little bit yesterday going, holy cow, is this going to change instantly 1/1 of 16 for everybody? No, it's not. It will change at renewal only if you lose grandmothered or grandfathered status for those small groups between 51 to 100. Okay. Lots of stuff today. Okay. They went on and talked about a promotional strategy. I want to make sure that you guys know, this is all about educating and engaging clients. You guys have to be using this. I kind of talked about this already, but make sure you've downloaded a mobile app with whoever you have your insurance with, whoever the carrier is. But Wellmark's really big on promoting their My Wellmark site. This is where clients, members will say, can go onto their site, see what their deductibles are, find an in-network doctor, find out what their out-of-pocket max is. This is where they can get another ID card, et cetera, right? But then, and don't forget about the personal health assistant. That's available 24/7. That's really that call-in, that nurse line you might hear to call, whatever, where I can talk to somebody and find out, well, I've got this rash. What do you think it is? Or, whatever it is. I've got a fever. My kid's got a fever. What should I do? That kind of stuff. But then the mobile ID card we talked about, and being able to download that app and have it now on your smartphone and just go, here you go. Or even on Wellmark's, you can email that right directly to your provider. The cost estimator and doctor finder, this one I think is not getting the amount of press that it should. We've got to continue to promote the cost estimator so that people have an idea of what that procedure is going to cost before they go in, and they can look at these tools and evaluate from doctor to doctor to doctor. The Blue 365 gives those extra discounts. It's the discounts on a Y membership, all that stuff. If you're not promoting that, that's another great piece to show your value with your clients, to make sure you've got some of those flyers. If you don't have those, again, let us help you get those ordered. And then don't forget, on there, they've got Find an Agent, which I played with that yesterday on my mobile app while I was, okay, just looking at my phone, which we're all doing nowadays, right? And I clicked on Find an Agent, and I put in it, it said, do you want my cell phone to know where I'm at? And I said, sure. I was sitting in Altoona at the Healthcare Symposium, and it found me agents in Altoona, and it did it by distance. And so I was sitting at the table with another agent, and I go, look, Tracy, there you are. See, so she came up on there. So test it if you want. Make sure you come up as an agent. You should. If you're contracted with Wellmark, you'll be coming up on there, okay? Okay, and then they talked about social media, and this is just a reminder, you guys, if you're not, okay, I said to the agent next to me, do you have a website? I don't know who it was. She wasn't my agent. This was at the Wellmark producer forum, and she goes, yeah, I do. I go, okay, good. I mean, you need to have a website. We've talked about it. We've got a gal that'll help you get a website, and we're going to help you with those costs. It's going to cost you $250 instead of $500 plus to get a website set up. The monthly ongoing fees are so inexpensive. And if you're a New York Life guy, you're a trans guy, you're a whoever you write your financials through, and those people are really picky about this, I know you've got to have a completely separate website. Let us help you get something set up at least, so some people find you. And if you need to have it as that other outside business activity approved or whatever, we'll help you with the approval. So do that. And then once you get a website, then you can really start talking about social media, because if you don't have a website to drive people to know who you are, what you do, and how you can help them, but be thinking about all of those things combined. And KHI, Darcy, our marketing at KHI Solutions, don't forget to Marketing Mondays. We do it the third Monday of every month. We do it over the lunch hour, kind of a lunch and learn kind of a deal. And Darcy's been providing some great content. And again, we record that, and that's out on the website. So anyway, just wanted to make sure you knew about that. And the whole social media website, yeah, it's not going away. And then some distribution updates Sean McTaggart gave. And he's really, they're focused on providing the best customer experience. So if you want to remain in good graces with Blue Cross, you want to be focusing on providing the best customer experience to that customer that you can when you represent Wellmark. And I say when you represent any carrier, you want to be providing the best customer experience to them, period. And I think let's keep that as our focus always. And just a tidbit, 4,500 agents in Iowa and South Dakota currently. I don't have the breakdown in Iowa, but clearly we have more agents in Iowa. I wouldn't be surprised that it could be 3,500 agents in Iowa and 1,000 in South Dakota. It could be something like that. I don't have that breakdown, but just know that. And then know this, that the minimum book of business is going to stay at 5 for 2015. They were going to move that bar up to 10, and there would have been a bunch more agents scrambling. In fact, many of you agents have said, hey, Lynn, let me know if you've got agents in my area. I'll partner with them, work it out with them. We'll continue to do that. There still will be some agents that have fallen below 5. They maybe were above last year, and they've fallen below this year because they're not writing. And granted, that's not a lot of business, but that's relationships that agent might have in another way that they can share with you. So we'll keep you posted on that. And then AORs, they said to date about 4,000 customers have moved. They've processed about 4,000 AORs. And I say good, because hopefully what's happening is clients are being served by the agents that they want. And we've had our wins and our losses. Luckily, KHI's agents have had a lot more wins than we've had losses. But this is really something to say, hey, guys, gals, make sure that you're in touch with your clients. If not, somebody else might be talking to them. So this is our motivation to make sure we're always providing value so that we don't lose that client. And then a cool partnership that they're entering into, we all know this, we're getting older. So am I, right? And how are we planning for the agent force that's aging on us? We've got to make sure we have some younger talent that's coming into the pipeline. Hopefully you guys have sons, daughters, nieces, nephews, grandchildren. I'm looking at that. I had a good conversation with my nephew, with another niece and nephew from the other side of the family. So I'm talking to people about what it is to be in our business, but it's not enough. And so Wellmark's working with the University of Iowa, I think Drake, I think there's other places, but in particular they've got a program that I'm excited about to offer internships. And if Wellmark can help fund those for you and I, are you kidding me? So I'll keep you posted on that as well, and we're really excited. So if you think you'd like to have an intern at some point in time in your office, in your neck of the woods, let me know that, as these are really early conversations right now with Wellmark and the University of Iowa, but stay tuned to that. Okay, I'm taking a deep breath here because I've got a little bit more, and I'm checking the time because I want to make sure we've got time for questions. But on the healthcare symposium, first of all, I do want to say this. You guys, for those I think that were there, I think it was a fantastic event. I thought it was. Surveys will be going out and asking for feedback on that. But when I see you there, I know you're serious about the health insurance marketplace. So when I saw you at either the Producer Forum or the Healthcare Symposium, and honestly, I didn't expect you to be at both because that's a lot of time out of the market, but Scott, thank you. I saw you at both. Anyway, when I see you at one of these or both of these events, I know you're serious about producing in the health insurance space. So please consider joining NAHU. Look at our website. Our local one is EIAHU. It's like E for electronic, Iowa Association of Health Underwriters, because I think IAHU was already taken. So just know that our local site has really been beefed up. Come join us and join NAHU. If you've already joined, thank you for your membership. I believe so strongly in this organization, and as most of you know, I'm also a member of NAIFA and feel so strongly about both of these organizations. But this one had to do with health underwriters, and Governor Branstad and Lieutenant Governor Reynolds were there, and they did a fantastic job and did a Q&A. It gives you that kind of exposure. They did have time. They met with some folks, shook hands. Our insurance commissioner was there. Same thing, to be able to press the flesh with the people that are that need to know about us and how important we are. And it is so good to feel finally they I think understand, no doubt, how important we are in the marketplace. Go back 4 years, and that was being challenged as they talked about navigators and putting people in to do everything online. I think we've shown our worth over the last several years, and it is due to organizations like NAIFA and health underwriters that have really been key, I think, in that, playing a role in making sure that we get elevated. So they had, also we had a really great presentation, and I'm going to meet again with this gentleman, Dan, that gave this presentation of the new role of the benefit broker under ACA, and that really is employer group benefit. If you're not in that space, not to worry, but if you are, it's really, we're having to step our game up, and I think many of you have already done that are with KHI, and I'm so proud of you all because I felt like as we sat through these last 3 days, we're on track. KHI is on track, and our agents are on track. If you feel like you're falling a little bit behind, please let me know. Let me get with you. Let me do a seminar with you for your clients, et cetera. They had a carrier panel that talked a little bit. You got some insights into some of the carriers, but it's just getting a little more up close and personal with the carriers. And then Kit Wager was there from Kansas City, and he's a government employee, which is really like, you want to go boo hiss, but no, really, Kit is here to help us, and he's been so good to make sure our issues were being heard, and he was here to present again this year, and I have his presentation, and I want to pop over just for a moment to a slide. I want to show you something, because I opened up, I said, would you please send me your presentation? So I have it. It will be out on the Health Underwriters website soon. But I have this, and I wanted you guys to see this slide, and I hope you can see it okay. But when we talk about the carriers that are coming into the Iowa marketplace, I was so glad to hear that United Healthcare is in the Small Business Health Options program. At least they have applied to offer coverage, right? And we're waiting for final approval. But I'm encouraged. At least we've got another small business player in case you've got that small business client. Remember, it's like under 25 employees and under 50,000 average salary. I mean, there's some caveats, but you may have some small businesses go, what about that credit? Can I get that as a small business owner? And it can be significant, up to 50% of the premium. So this is, to me, a big deal that we've got a new player there since Co-Opportunity left this space. I want you to also notice some of the other plans. I always refer to Coventry, Medica, and United Healthcare in the individual market, and I tend to leave Avera and Gunderson. And I only do that because we are not part of their distribution channel. And you as an individual agent might be aligned somehow, but they're in such a small area of the state that we have just chosen to stay focused on the major players. And so KHI has contracts, as you know, with Coventry, Medica, and United Health One. And then in the small business space, of course, we have a contract with United Healthcare. So Anyway, I wanted you to see that slide, but he had some really great information. And if you're interested in learning more about this, again, shoot me an email or give me a phone call or a text and let me know. We can sit down and visit. He had some other great numbers about enrollment and things like that. And if we have time today or if you have specific questions, I'd be happy to answer those. I'm going to hop back over to our presentation here and just follow up by saying we offer at KHI a discount because we list bill. And the more people I can get that are members of Health Underwriters that will join our list bill, the deeper discount I can get for you guys. Today it's only a 3% discount, but it's 3%. So it's only $30 or $40, but hey, I can get you at least that discount off of your membership. And so anyway, see me or actually Misty, because Misty knows how to get all that coordinated. And then we're as flexible as saying, hey, if you'd like, it runs $375 a year, so that's just like, what, $40 a month or something like that. But we can, or not even that, sorry, 30-something dollars a month. We can either take that out of your commission check monthly, or you can just write us a check, or we can take it out all at once, whatever you prefer. You can just let Misty know your preference. And I just encourage you guys, join. If you're committed to this market and you've been hearing me harp on this forever, please join this organization and take advantage of the discount that we'll get to you. And if I can get, I think I've got more than 10 now, and if I can get more than 20 agents on, then we get a 5% discount, and then 10%, et cetera. So, okay. And then last but not least, and then I think we open it up for Q&A, is the Medicare Access and CHIP Reauthorization of 2015. So if you Google, and I did, HR2, you will see the legislation come up. You'll see the bill form, and then you'll see that it actually became law in April of this year. And I went in. There are so many things in there that don't matter to us as producers, but that matter to, let me go back into slide mode here, but that matter to the beneficiaries or to the doctors in terms of their reimbursements. But this one was important. So if you read this like I'm reading, it says it amended the Social Security Act that it's going to deny Medigap policies that cover Part B deductibles to Medicare beneficiaries newly eligible on or after January 1 of 2020. So I took this right out of the regs, and I'll tell you this, what I see has been going on in the market is a little bit of, hey, you better move to G now. Now, if a competitor to you is having that and scaring your client, and your client calls you, I want you to tell them to take a deep breath. That this is talking about those on or after. So what this says is if you currently have it, you will be able to keep it. Now, initially, there was rumor that all the Fs will have to move to Gs, and all the Ds will have to move, or Cs will have to move to Ds. And we were trying to get clarification on that. More will come on this, you guys, as this becomes a bigger deal. The date on this, as you see, is January 1 of 2020. So things can change between now and then, but I want you to know what the law says right now is it's only for those newly eligible on or after January 1. So as you sell an F today, if somebody wants an F, you sell them an F. I've talked to Blue Cross and I've said, don't delay bringing out your G. Because of this conversation, people may want to say, you know what, I'll go ahead and pay that deductible, and I'll take G now to save the premium. So please, just know this is the fact right here, and I've been talking to Wellmark about it to learn what they're going to do. We've got all kinds of other carriers, whether it's Aetna, Equitable, Mutual of Omaha, they currently have G. So, and many of you know this, so okay, I just wanted to get through that because there's been lots of scuttlebutt and, talked about that. Okay, so let me open it up now to any questions that you might have and go to the phones. And it looks like we've got a question here, and let me bring it up here. Okay, so Randy says, if you had to pick just one carrier on the marketplace, who would it be? We currently have Aetna and just don't want, Aetna Coventry, sorry, probably, and just don't want things too complicated for the amount of under 65 we actually get involved with. Well, that's a great question, Randy, and I can't answer that today because I don't know what the products and the rates look like. And so it's kind of a catch-22. If you wait to get certified or contracted with that product, the good news is that you will always, right, if you're playing in the under 65 space, do your marketplace certification if you just want that certification. And then the other piece is just learn about and get contracted with the other carriers. So I would probably recommend right now, if you're a little hesitant, hold on. We'll be having the training, as I just told you, September 30th and October 1st will be Medica training. Hopefully we'll have products and rates. Rates might get delayed. Sometimes they tell us, here's your product, and then hopefully we'll get rates, sooner than later, sooner than October 1st. But remember, a lot of times they won't give them to us till October 1 when we can begin to market the products, right? Or actually, sorry, I'm getting it. October 1 is Medicare. Let me get back to Obamacare plans. November 1 is when we can actually start selling. So when will they release rates? That's what we don't necessarily know yet. So maybe stay tuned on that to see, because I really believe when we're doing what's right for the client and we look at the product and the prices, Medica's got a great track record. United Health One has a great track record. They really do, as companies that don't just come in and buy up market space. The gal from Medica yesterday addressed that. So they've had a very level space. They don't go in and buy business. So let's wait and see what rates and products look like, and then you'll get a flavor. And I'll be updating you guys as well on these monthly calls. As if we're excited and really fired up about what we're seeing, we're going to relay that to you, and then probably encourage you, if you play in that space, to get contracted with the other carriers. Another question, AHIP training is required, correct? Yes, it is. Even if just marketing Wellmark or Part D, yes, it is. So if all you're going to choose to do, for those of you that are just pretty Wellmark-centric only, you're going to do your AHIP and probably go through Wellmark. They try to get a discount for folks if you go through theirs. Please hold on, if you can't wait, you want to do your training now, call Lindsay or Julie and they'll talk you through what we know. But we're in the process, and hopefully next week this document will come out saying, here are all the carrier links, the AHIP, and where's the best place to go to get your AHIP. We think it's through Humana right now if you're going to write Humana. But yes, you must do AHIP even if you're Wellmark-centric only in the Medicare space. And then another, pet insurance for a pug. Where do I sign up? I love it. Yeah, just give Lindsay or Julie a call, and they'll help you walk through if you want to buy it for yourself and or if you want to market it to your clients. Sherry says, man, a lot of great information today, Lynn. Thanks for all your hard work. Oh, bless your heart. You're welcome. You guys are so welcome, and keeping you guys up to speed. Thank you. I try to provide this value to you guys. I appreciate your feedback. It's good. And then Paul says, how soon can we send or start quoting our 12-1 small group through KHI? I know we started already quoting out some of the ancillary stuff. We've got a great arrangement with Principal, so we were already doing that. But as soon as, I think what we want to do is just wait until September. We should get them, of course, by September 1st. But as soon as we get the Wellmark, all the Wellmark renewals, and those tend to come out prior to everybody else's, then we'll start getting some quotes done. And as I mentioned earlier, our quoting tool, you guys, this quoting tool that we're looking at, that we're so excited about, is individual and small group. And can you imagine if we could layer, and this is what we're asking for Wellmark's blessing to use this and the blessing to have Wellmark on this quoting tool for both individual and small group. And if you can imagine, if we could have all carriers side by side entering demographics once, worst case scenario, we may go ahead with this for all the other carriers, and we don't go ahead with it on Wellmark, because, you guys, we value our Wellmark contract, and we're asking for their blessing. And if they say we can't use their information on this tool, then we absolutely will not. But we may want to have this anyway. So sorry, that was a little more than what you asked, Paul, but good. Keep the questions coming in. I see some more coming in here. Kay says, if we're currently contracted with United Health, do we need to do new paperwork? No, okay, the beautiful thing is let Nicole know, and there might be one thing you need to sign, but we just move you over with your blessing. So if you'll just get with Nicole, and it's just Nicole, Nicole, I think you saw that, at KHI, just send her an email and let her know you want to slide it over. And it'll be exactly the same, but you'll get our support because we did secure a general agency contract on the United Health One under 65 business. So thanks for the question on that. Scott says, any update on the GA contract for KHI with Coventry Aetna? Thanks for asking, Scott. I am so excited and positive about just the continuing ongoing relationship that we have with them that I won't know until we get a little bit closer to the end of the year. It probably won't be until the November timeframe that we might find out. Um, but I'll keep you guys posted as soon as I know. But I'm feeling, as the gentlemen and women were saying yesterday, quite bullish. I'm feeling quite bullish about it, and I'm very optimistic. So, but we'll wait and see. But thanks for the question again. And then Donna's saying, Medica will offer both on and off exchange, and you need to be contracted before going to the training for Medica. I don't think you need to be contracted before going to the training, but it's helpful. Let's get it going, because we are, at least if Nicole's handling all of that, so let her know. And the answer is yes, they'll be offering both on and off exchange products. And then Scott, oh, thank you, and thank you. You're welcome. Wow. Okay, I'm like totally out of breath, and it's 10 o'clock. So if there's not any more, I'm not seeing any more questions come in. Please, you know what? If you have any other questions, shoot me an email. And bear with me, you guys. Being gone on vacation last week, I'm buried on emails. Texts have been working really well. If you need to get to me right away, please send me a text. 515-570-8811 is my mobile number, and you can text me 24/7. Okay. All right. Well, God bless you guys all. Oh, my gosh. Have a great day. Have a great weekend. Enjoy if you go to the fair. And we'll look forward to talking to you next month, if not sooner. All right. Take care. Bye-bye.